Hi everyone, Dr. Hall here. So our second lecture on abortion, we're going to talk about who gets them and why, what some of the controversy is, and then maybe what are some policies that we might want to be thinking about as a nation. So before we talked about how abortion has been with us for a really long time in human societies, it was illegal for less than about 150 years, during which time it still occurred, right? So as Lana from the documentary said, a woman who is unhappily pregnant will risk her life to end that pregnancy. And so many women did risk their lives and many women died. It was very dangerous. It was unregulated. It was criminal. There were lots of deaths and infections and sexual assaults. So in 1973, abortion was made legal in this country, but with restrictions and laws, some of which at the state level and some at the federal level. So federally, we have the Hyde Amendment, which says that no federal funding can be used for the provision of abortion services, even though they are legal. And Title X now prohibits any of its recipients from discussing the option of abortion with their patients. Many states, right, have laws like Wisconsin does requiring ultrasound, mandatory counseling, and a waiting period. But overall, today it is legal and it is safe. Most commonly occurs in the first 9 weeks of pregnancy when the embryo is smaller than a dime, but it can be difficult to access. So who actually gets abortion? So I'm going to ask you to take a moment and picture in your mind's eye who you think the typical abortion patient is. How old are they? Is this their first pregnancy or a further pregnancy? Are they wealthy? Are they poor? Are they educated? Are they not? Kind of form a picture in your mind's eye of who you think the majority of folks getting abortions are. And then let's see how well that compares to reality and what we know. So first of all, I want to remind you of the fact that this is really common. So somewhere between 20 and 30% of all US women, this has been decreasing over time due to the accessibility and affordability of contraceptives, primarily the highly effective ones such as the LARCs, the implant, and the IUD. But abortion is still a very, very commonly performed procedure. So let's just keep that in mind. Oh, let's bold it to really keep it in mind. All right. So of course, the number one predictor of getting an abortion is an unplanned pregnancy. As we mentioned, if it's a planned pregnancy, usually you are happy to be pregnant and will continue through to childbirth unless a severe medical complication arises, which does occasionally happen. But for the most part, the number one predictor of getting an abortion is having an unplanned pregnancy. That's the number one risk factor. So we have a lot of unplanned pregnancies in the United States. So about 3 million per year, of which about half of those are people who were using birth control at the time, most commonly birth control pills. As we talked about, the average number of pills that are missed in a typical month is 5, right? So significantly reducing the effectiveness. So typical use effectiveness for birth control pills is about 92% because of those missed pills or getting late started on the next pack. And we know that of all unplanned pregnancies, slightly fewer than half of people in those situations choose abortion. We also know that the people who weren't using birth control when they got their unplanned pregnancy are actually more likely to choose abortion, which is kind of interesting. And just remember, a large number of pregnancies are unplanned. Oh, let's bold it. Really remember it. Okay, we're getting better with unintended pregnancies, right? We've seen this data before, and again, we see this real change in the curve once we instituted the Affordable Care Act and insurance had to cover contraception and young people could stay on their parents' insurance until they were 26 and all kinds of other things to make healthcare more accessible to people. That was very powerful in reducing the number of unintended pregnancies, and as we saw previously, also decreasing the number of abortions that are happening in this country. So this still varies a lot geographically, and this is done geographically by state. I kind of wish that they did it by metropolitan region, because then I think some areas would look very different than they do currently. But as you can see, the unintended pregnancy rate is highest in the American South. New York State is a bit of an outlier there. And you see those little stars that I've put in, those are states that have a state law that requires comprehensive sex ed in their K through 12 system. Comprehensive sex ed means you have to teach about birth control, right? You can't just say, if you don't want to get pregnant, don't have sex. Because as we know, for a lot of people, that's just a standard to which they cannot adhere. Sexuality is part of being human, and so things happen. So I think it's kind of interesting to think about that. It's also interesting to think about the fact that, so Wisconsin, we have a relatively low unintended pregnancy rate. We also have that family planning only service, right? So we have made contraception free for our state residents for many years, actually, and that has an impact. The other thing that I want to bring up about the comprehensive sex ed is that in many states, even if state law doesn't require you to have comprehensive sex ed, and you can see most states do not at the state level, those individual decisions are made by school boards and school districts. So there is no, although there are kind of state curricula about about sex ed, not really about birth control in the state of Wisconsin anyway. If you as a school district or a health teacher want to teach about birth control, you can. So just looking at state laws doesn't necessarily give us an idea of what's actually happening on the ground. But lots of people have looked at studies in unintentional pregnancy, and we know for sure that the rates are actually higher in states with abstinence-only sex education. There's a lot of really good data out there that shows that if the entirety of your sex ed is telling students not to have sex because if they do, they'll get pregnant or they'll get a disease, that actually doesn't work. And in fact, age at first intercourse is younger in areas with abstinence-only sex education. And they actually find that in areas where they do comprehensive sex ed, that students often delay sexual activity until they're a little bit older, and they tend to engage in less risky sexual behaviors. So giving people the full gamut of information seems to actually be able to allow them to make decisions that are better for their own health. We also know that rates of unintentional pregnancy are higher in states without easy access to contraception. Again, I mentioned in Wisconsin, we have that family planning only service, and that has helped keep our rates lower. So this is the data that explains something that I mentioned earlier. So whether or not you are using contraception tends to be a predictor of whether you're going to end up choosing an abortion. So what's interesting is that there's a very small portion of people who are at risk of pregnancy but not using birth control. And those folks account for the majority of abortions in this country. And so when they ask those folks about why they weren't using birth control, they either say they didn't think they would get pregnant, which is really fascinating, right? And I still encounter this in my practice. Actually, I'll be meeting with somebody and I'll say, oh, so are you hoping to get pregnant? And they'll say no. And I'll say, well, so what are you using for birth control? And they'll say nothing. And you would think that people would, if they're sexually active, that it would occur to them they should protect against pregnancy. But humans are not always rational, especially when it comes to pleasurable behaviors. And so it's really interesting. And then even if they did realize they might be at risk of pregnancy, they often have concerns about contraceptive methods, right? Like, oh, I heard birth control pills can kill you. Oh, I heard birth control pills are dangerous. They're not good for you. It's artificial. It's not natural. Right, so there are a lot of negative ideas out there about birth control. And I'm not saying that there aren't risks to birth control. Absolutely there are. But I think oftentimes people are exposed to the idea that those risks are much larger than they are. I think they often get overblown in people's minds and prevents them from perhaps making the best decisions for themselves. So a minority of our abortions actually occur in the people who were using contraceptives but got pregnant, which does happen, as we talked about. And again, they say most people are in this category had difficulty using them consistently, right? People who are forgetting to take their pills. So how old do you think most women choosing abortion are? Let's take a look. So interestingly, the vast majority are in their 20s. A lot of times people have this idea that it's mostly teenagers, but it's not. Now, part of that reason is because 50% of teenagers are not having intercourse, right? When you get up into your 20s, a much higher proportion of the population is sexually active. So people in their 20s, because they're more likely to be sexually active, are more likely to have an unintentional pregnancy. So in fact, they also make up the vast majority of people who are choosing abortion. And people in their 30s and beyond are about a quarter of those folks. A couple of other statistics that may surprise you. More than half are already mothers. More than half already have at least one child at home or more. Fewer than half are single. So about 55% of people choosing abortion are either married or in a long-term relationship. They're partnered. So that might be different than what you would typically expect. Also, we find that the vast majority, so about 70%, are below 200% of the federal poverty level. So 70% of people approximately choosing abortion make less than $24,000 per year, right? This makes sense when we think about the economics of raising a child. Interestingly, they asked them about people's religious affiliations. And so these percentiles, 37% Protestant and 28% Catholic, are roughly representative of the general population. So what this tells us is that in general, people who are religious are no less likely to choose abortion than people who are not religious, which also might not be what you would expect. So most women who choose abortion are in their 20s to 30s, married or partnered, poor, already mothers, religious, and not using birth control at the time of their unintentional pregnancy. So finances are a big piece of this puzzle, right? When we think about the cost of raising a child, it's estimated to cost over $200,000 for kind of the median household in terms of expenses from birth until age 18. So first of all, there's time off work for childbirth, and the United States is the only developed country that doesn't provide paid maternity leave. We do have something called the Family Medical Leave Act, which allows for up to 12 weeks of unpaid leave for a medical reason if you've worked at your employer for a year or more, and your employer employs more than 50 people. So there are a lot of folks who get pregnant or give birth who have not been working for their employer for a full calendar year, and maybe it's a small business that doesn't have 50 or more employees. And so there are a lot of people in this country that don't even get any leave, even if it's unpaid maternity leave. So that's really difficult because you cannot just pop a baby out, especially if it was a C-section, and then go back to work the next day. You just can't do that. Right? And then of course there's housing, for the child. You might need a bigger apartment or a house, food, which when they're young is not too much, but then boy, when they're teenagers, they can really eat quite a lot. Clothing, which they're constantly growing out of, and then the supplies. So certainly in infancy, those diapers are super expensive, and there are lots of stories of families that don't have financial means where they use the same diaper all day long. Much to the detriment of the child's health, or they are using plastic grocery bags that they put newspaper or paper towels inside of and kind of put the baby's legs through those. Diapers are really expensive, and wipes, car seats, formula, bottles, cribs, all these things are very expensive. One of the biggest expenses is daycare. So for most women in our economy, it costs just about as much money to put their child in daycare, especially if it's a young child, an infant or a toddler, as they earn at their job. So it's really hard for someone to be like, okay, I'm going to end up financially neutral. All of my paycheck is going to pay for daycare, right? When I could just stay at home and be with the child myself. Right? But then, of course, if you do that, you may not have health insurance, you don't have retirement benefits, and all the other things that go along, potentially, hopefully, with being employed, depending on your employer. And then, of course, babysitting for other things. Raising a child can be really challenging emotionally. Nobody can push your buttons like your child can push your buttons. I've done lots of difficult things in my life. Medical training, residency, internship was at times really grueling. I've been in lots of very stressful situations with patients. And still, I would say my child has presented just as much of a challenge to me on many days as the most challenging work environments. Then there's that loss of freedom and independence, which is not insignificant. Now, for some people, the emotional rewards of being a parent and raising a child far outweigh those, but for other people, it's very different. We all have different personalities and different needs. It takes a lot of time to care for a child. Some kids are easier than others. Some children are very demanding and require hands-on all the time, and that means less time for you to do other things, which might or may not be things that generate income for you and your family. And then, of course, having a child can significantly disrupt your education and your career path because of those time, emotional, and financial needs for child rearing. And then that can impact your ability to earn a good salary down the road. So the implications are large. And so, in fact, when they ask people why they chose abortion, so actually very few people said it was because it was going to interfere with education or career. Some people said, I am not mature enough, or I don't want to be a single parent. But the biggest reasons, these here, right, are that I'm not ready and I can't afford it, right? So those financial implications are really huge. Or I'm done, right? We tend to think of people choosing abortion as people who are not already parents, but many of them are, and they just cannot handle another child or do not want to have another child. So this again speaks to the economic indicators. So we know that of people who choose abortion, that 76% report they don't have enough money to cover living expenses. And in this particular study, 51% were below the 100% federal poverty level, right? So half of people experiencing or choosing abortion make less than $12,000 a year, right? So it follows that they don't have enough money to cover basic living expenses for themselves, let alone also for a child. This was an interesting study called the Turnaway Study, and what they did was they took a large cohort of women who were choosing abortion and seeking abortion. And some of them did go ahead and get an abortion, but some of them lived in states that had restrictions on how far along in your pregnancy you could be and were turned away. So it's often called the Turnaway Study. So they looked at women who chose abortion but were denied an abortion and compared them to women who chose an abortion and got them. And it was just based on how far along they were in their pregnancy. So for those who were denied a wanted abortion, which is this top graphic here, so denied a wanted abortion, they had a 3 times greater likelihood of being unemployed 1 year later than women who obtained abortions. Now you might say, well, of course, because they're at home raising the baby, which they probably are, right? But that also means that they can't be working, which has huge economic and social impacts. And so also, after being denied a wanted abortion, they had a 4 times greater odds of being below the federal poverty level than women who got an abortion. So what was really interesting about this is there was no difference between the two groups when they initially made their choice to seek an abortion. The rate of people above and below the federal poverty level was exactly the same. But then afterwards, 1 year later, the group that did get the abortion was much less likely to be living in poverty than the group that did not get the abortion. So the economic impacts of parenthood are enormous. So let's look at what we know about abortion worldwide, just a few slides, because sometimes we can learn a lot from how other countries do things compared to how we do it. We can get some good ideas or sometimes some cautionary tales. So this is a document prepared by the Guttmacher Institute that studies abortion. That's kind of their academic mission. And so on the top here in orange, we have the countries with the lowest abortion rates per 1,000 women. And so we can see Switzerland is way at the top there with only 5 out of 1,000 women choosing abortion. Netherlands, Belgium, right? A lot of these Scandinavian countries are very, very low. United States, at this time, this was data from 2014, we were at 13, right? So almost triple Switzerland, less than double the Netherlands. And then we can see down here the countries with the highest abortion rates. And so you see Pakistan there is listed as the country with the highest estimated abortion rate. These are indirect estimates because these are countries where it is difficult to get this data. So by way of kind of understanding what might be driving those high abortion rates, there's a really good NPR story that you can listen to or read the transcript of that is an extra credit event that is posted in Canvas about why the rate in Pakistan is so high and what can we learn from that. So if you compare us to the Netherlands, which is a really interesting country, they have a significantly lower abortion rate than we do. And so in the Netherlands, all adolescents receive comprehensive sex ed. They all get taught about all the different types of birth control. Whereas here in the United States, we actually have some states that prohibit anything that isn't abstinence only. And then we have other states that don't say you have to do abstinence only. They don't prohibit you from teaching about birth control, but they also don't mandate that you teach about birth control. And we know that those abstinence only states have significantly higher teen pregnancy rates. In the Netherlands, birth control is free and easy to access. In the United States, it's gotten much easier, but it can still be difficult. You still have to have a doctor's appointment, and that can be difficult to arrange. We still have about 20% of our population doesn't have health insurance. We've recently defunded, we've made it impossible for Planned Parenthood to get federal funding through Title X, so we've had a decrease in access for that reason. So for a lot of people, it's easy to access birth control, but for some people, it's still difficult in the United States. In the Netherlands, abortion is free and easily accessible, and that's kind of the opposite of here in the United States. It's not free, and for many people, it can be difficult to access. So their abortion rate in the Netherlands is about 10%, and ours is about 22 to 30% of all pregnancies. It's also interesting to look at poverty levels. So in the Netherlands, it's about 10% of the population overall, and 11% of children are living in poverty. In the United States, our overall level is not all that different. It's about 12.3%. However, 21% of our children are living in impoverished households. So that's 28 million children in this country who are living in poverty, 1 in 5. And in Dunn County, for example, we know it's much higher than that. We have a high proportion of our school kids who are Title I. They qualify for free and reduced lunch. More than 50% of children in our district actually receive Title I funding because they come from households that are impoverished. And we also have 500,000 children living in foster care in the United States, right? So these are children whose families were unable or unfit to care for them. And we're seeing this rate is going up now in large part because of the meth crisis and the opioid crisis in our country. So when we think overall about who gets abortions and why, right? Absolutely those who get pregnant who didn't want to be pregnant. And as we're discovering, a lot of those folks who then go on to choose abortion are people who weren't using birth control in the first place. So while on the one hand, we've made significant strides in improving accessibility to effective contraception for folks, we still have a long way to go in terms of education and further accessibility. We also know that the vast majority of people who choose abortion abortion are people who have very low income. They have very low financial resources, and that is the primary driver of their decision in many cases. We also know that most people who are getting abortions are in their 20s or 30s. They are already parents, they are often partnered, and that they are just as religious as anyone else. So our next section of this lecture, we're going to be touching a little bit on the controversy, just to acknowledge some of the arguments that are out there, and then we'll sum up by kind of taking a more data-driven approach to what some sensible policies might be.